I'm Karim Fizazi, medical oncologist from Gustave Roussy in Villejuif, France. So this year we saw data from Prosper and Spartan, two randomized trials looking at patients with castration-resistant prostate cancer but no metastatic disease. So in other words, patients who have typically been treated locally, who have failed androgen-deprivation therapy by PSA, you do a bone scan, you do a CT scan, you don't see where the disease is located. Until now, there was no standard of care besides continuing androgen deprivation therapy and wait for the metastasis to happen before switching treatments. For the first time this year, we saw that with either enzalutamide or apalutamide in these two trials, when used earlier in that situation, you will postpone time to metastasis or death, and the difference in metastasis-free survival is actually quite big, 70% reduction in the risk of death. At the moment, overall survival data are immature, simply because most men in these trials were alive at the time of the analysis. We know that in one of the two trials, Spartan, there is also a benefit in symptoms, in time to symptoms. So the question now is whether this is practice changing, because it's big difference, but it's mostly image-based rather than clinical-based. So it's currently debated. On top of that, we're now not necessarily using only bone scan and CT scan. We're also using next-generation imaging in these men, say PET choline, PET PSMA, whole-body MRI, and we see much more metastasis than we used to see in the past in these men. So it's really changing. Now, there's also some side effects, and this needs to be taken into account before decision making, because there is an excess in fractures, cognitive impairments, and cardiovascular problems. Next is continue the follow-up of these two trials and try to figure out whether eventually there is also overall survival improvement. But also we're waiting for a third trial to arrive, and it should actually arrive soon. A third drug is called darolutamide, and it's a different androgen receptor antagonist. One of the advantages of this drug is that it doesn't go into the brain, so we may expect less cognitive impairment, for example, less fatigue, etc., falls, etc., in these men. So we will see. And also, in vitro, the drug seems to be more potent against prostate cancer cells. So the Aramis phase 3 trial is very similar to Spartan and Prosper. We've just heard the very first data. We had a press release a week or two ago, and we know that the primary endpoint of metastasis-free survival is significantly improved, so it's met. So we will see the data very soon.